Kia ora, my name is Heidi and I would like to talk about two standards that are relevant for our practice as a sterile service technicians. So I would like to begin with the Australian Standards 5369-2023. The scope of the standards. So the standards ensure the safe and effective reprocessing of reusable medical devices to minimize the risk of infection and to promote consistent best practice sterilization processes and to support regulatory compliance and quality assurance as well. The standards apply to a wide range of healthcare facilities, such as hospital, medical clinics, and centers with practices like dental, podiatry, aesthetics, and body modifications, between others. The exclusions are, well, we shouldn't be reprocessing single-use instruments, reusable medical device with CGD disease, medical consumables such as bandages or dressing, other objects such empty plastic water bottles, rubber bands, cardboard materials, spoons, or paper clips. The standards doesn't apply to equipment or indicators. So this means this standard doesn't apply to autoclaves or ultrasonic cleaners, washer disinfectors, or hydrogen peroxide sterilizers, or doesn't apply to chemical indicators such as PCD or BAWIDIC, or biological indicators such as celerity. A service needs to comply with a lot of requirements in order to show they are following the best practices. They have to follow this standard, but I'm going to highlight some of the requirements they need to do to show they are following the best practices. They have to have written policies and procedures for reprocessing, and they need to define roles and responsibilities for the staff. They need to provide training and assessment for the staff as well, and keep the equipment calibrated and maintained. They need to identify constantly risk and hazards and ensure contracts with third parties like suppliers or sterilization services, and be sure they comply with the standards as well. They need to conduct audits, reviews, and take corrective action if necessary. They need to use only approved, validated, and compatible cleaning agents or disinfection agents or sterilization agents. So they need to maintain the safety data sheets with all this information, and of course the manufacturer's instructions must be followed. They need to do risk assessments based on the Spaulding classifications to identify if the reusable medical device is critical, semi-critical, or non-critical, and take the decision if the device needs sterilization or high level of disinfections. If they manage a new or complex device with lumen or heat sensitivities, they need to do a risk assessment. They need to clearly define a step-by-step of the reprocessing cycle, keeping a quality management system. So I'm talking about all the stages of the process of reprocessing cycle: cleaning, disinfection, inspection, packaging, sterilization, traceability, and storage. They need to ensure water quality, extend supplies, and utility meet the standard requirements as well. They need to maintain process effectiveness. How they do that? They need to validate and verify process regularly and keep the records of everything. So which one is the cycle, the number of the cycle, who was the operator, which type of equipment, and the result of the printout, and if the equipment or the device of the procedure change, they need to revalidate the process again. If the cycle is no conformance, they need to take corrective actions, and everything must be auditable and need to show it's continuously being improved. Let me give you two examples that comply with the Australian Standard 5369 in 2023 in my daily practice. The cleaning procedure for reusable medical devices. When we have an instrument with multiple parts, I disassemble the device to the small part and open the instrument to be sure the instrument is exposed. All the surfaces of the instruments is exposed to the cleaning process. And I follow the manufacturer's instruction to prevent the damage of the device. When we manage the cannulated instrument, I always be sure they are well attached to the lumen flashing tube for cleanliness. This attached to the rack before going inside in the washer disinfector. This complies with the standard AS 5369 in section 6.2.3 section F. Let me give you the second example. At the end of the sterilization cycle, I always check the printout to verify if the cycle was achieved the expected results before releasing the lot. So I check the time, the temperature, and pressure. So the time has to be 45 minutes for a light load or 60 minutes for a heavy load. The pressure has to be 210 kilopascals and the temperature has to be 134 degrees for at least 4 minutes. This complies with the standards AS 5369 in section 6.5.3, moist heat sterilization. And we can find figure in the standards in section 6.1 with temperature pressure relationship for moist heat sterilization. The second standard I'm going to talk about is the New Zealand standard A134-2021, Na Parewa, Health and Disability Services. This standard provides the framework for quality, safety, and consumer rights. Make the service culturally respectful and ensure the staff and the care environment meet the needs of people and the community in general. So The standards applies to all health and disability service providers in New Zealand, including private and public hospitals, residential care, mental health and addiction services, disability support services, among others. Who should be using the standards? Who are the users of the standards? Anyone responsible for planning, providing, monitoring, or managing health and disability service in New Zealand. So this means healthcare management, clinical and support staff, auditors, and of course, we are the users of the standards as sterile service technicians. How the New Zealand standard A134-2021 is relevant to the Australian standard 5369-2023. Well, the New Zealand standard set the framework for quality care, patient rights, infection prevention and control, workforce competence, and safe environment. And the Australian standards provides the technical best practices for reprocessing of reusable medical device. So, in our daily practice, if we follow properly the Australian standards 5969, we are complying with the New Zealand standards. This means our daily practice meet the infection prevention, competency, and safety requirements. Let me give you an example of how in my daily practice I comply with the New Zealand standard A134. Well, when the cycle fails of indicator is doesn't comply with the expected results, I immediately report the non-conformancy and the load has to be reprocessed again. So we find in the New Zealand standard A134-2021 in section 5, infection prevention and antimicrobial stewardship, which requires infection prevention and control monitoring and incident reporting and corrective actions. So by monitoring, documenting, and acting on disinfection results, I ensure patient safety and maintain compliance with the New Zealand standard A134. Nami Hinua.